Good evening. It is 4:05 p.m. Thursday for our lecture and review. Remember that the Chapter 15 exam is tomorrow.
Yay!
And you only have until Sunday to complete it by being on a Thursday, the end of the week. So remember, you had your Chapter 14 exam that opened on Monday. It is due on Sunday as well as this Chapter 15 exam that will be open on tomorrow, but it is due on Sunday as well. So you have two exams that are due on Sunday, Chapter 14 and Chapter 15, which we are covering now, the musculoskeletal system. So it's not that much, like I keep explaining, it's not that much that you will be doing as far as the splints and all of that, but you will need to know how to code the information. The most important thing with the musculoskeletal system is where to find the codes in the section. Like this day really is only like 3.5 days that you're in musculoskeletal system, because it's really not much that you all would need to do, but being able to get that information out of that medical chart and then knowing how to code what the doctor has placed in the medical chart. So for our review, what I'm going to do, we're going to go over these PowerPoint slides, because a lot of the information on the PowerPoint slides is what's going to be on your exam. The exam is not going to be long at all. I think I can't remember, but it's 15 to 20 questions that's going to be on your exam. And I will not be grading as hard for my newer students for the actual coding, because I know the newer students are not really familiar with the coding. But for my seasoned students, I will be grading you. Misty, don't cover your eyes. I will be grading you.
2.5, 3 months left, something like that.
I know, you're almost done. Yeah. Which is amazing. So I'm about to share my screen. And we're going to go right to the PowerPoint slides. So we left off on dislocation a lot of part, but I wanted you all to, because this is on your exam. Dislocation is bone displaced from normal joint position. So if your bone, it says dislocated, that means it's displaced from the normal joint position. And they're showing you a picture on this diagram on what it looks like when it's displaced. It says treatment. The treatment is to return bone to normal joint location. So it's dislocated. Sometimes if you have a fall or something happen, and it's not that it's broken all the way, it's just shifted, dislocated. And so the treatment is to put it back into the normal position. And so they're showing you right here, vertebral dislocation, subglenoid dislocation. So it's just showing you how it can shift a little bit and then it puts back. And I told you all, because if you all are reading the questions that's under the PowerPoint slides, and you're actually looking at the questions it's asking, you'll do really, really well on your exams, because a lot of that information is pulled from your PowerPoint slides, as well as from the chapter. What is the difference between a fracture and a dislocation? This is, with a fracture, the bone is broken. See, that's the difference. A fracture is actually broken. With a dislocation, the bone is displaced from the normal joint position, but it is not broken. So that is the difference between a fracture and dislocation. How is a dislocation treated? And it tells you by moving the bone back to the correct position, which it states right here and shows you what it looks like. So the subheading starts out with general and the subsection range. So this is going to be very helpful when it comes to your NCCT certification exam. Looking and knowing the different code ranges. Like I stated, the entire exam, your entire certification exam, is multiple choice. Multiple choice, where it's true, false. That's when you really have to know, like, the information. It's those little trick words: can and can't, will and want, do and don't. It's those little words that you have to pay attention to, because I noticed that on the exams, when I'm giving it to you, those true, false questions, a lot of you would have hundreds. but you all mess up on the true false because you're not reading it in its entirety. You read that first little part of the sentence and it seems like it's right, but then that next part of the sentence might be can't when it should be can, will, and it's won't. So read your information in its entirety. Read the entire statement before you mark an answer. I've noticed that with quite of the true false. Then the ones that are false, you're marking true. The ones that are true, you're marking false. And that's from not reading it in its entirety. So the subheading for general is 20,100 to 20,999. It begins with wound exploration. The depth is the difference between integumentary and musculoskeletal incision codes. So it's how deep. That's going to be the difference between if it's in the skin integumentary or if it's musculoskeletal. Musculoskeletal used when underlying bone or muscle is involved. So that's the difference with integumentary. It's skin. The integumentary system is the skin. The musculoskeletal, and it's telling you right there, musculo, and skeletal, bone, muscular, muscle. It's telling you there when it's the underlying bone or muscle involved. So if you break it down, muscular, muscle, bone, skeletal. So that's how you're able to determine if it's the difference between integumentary and musculoskeletal. It says the general subheading contains codes for procedures that are not associated with a particular anatomical region. The first codes in the section deal with incision treatments. So that should help you with understanding incision. That's the first set. That's what it deals with first, the incision. When should integumentary incision codes be used instead of musculoskeletal codes? Integumentary codes for superficial incisions, musculoskeletal codes for involvement of underlying bone or muscle. So with integument, like I said, it's going to be that superficial, the skin, anything dealing with the skin. But if you have to go into the muscle or the bone, that's going to be musculoskeletal system. General subheading for the wound. If it's going to be an exploration, this is the code range, very short code range, 2100 to 2103. Traumatic penetrating wounds, divided on wound location, body site, includes enlargement, debridement, foreign bodies removal, ligation, repair of tissues and muscles. Wound exploration codes are used for the treatment of traumatic penetrating wounds. These codes include wound enlargement, and it's telling you that, again, everything that we just read. And so it tells you here, how are wound exploration codes organized? By location of the wound. How are wound exploration codes organized? By location of the wound. General subsection continue. Still look at this code range. It's still 2100 through 2103. These procedures describe the surgical exploration to any already open wound. These codes are separate procedure codes. They can be coded and reported in the following circumstances: if only procedure performed, if totally unrelated to another procedure performed at the same session. So let's go over this again. These procedures describe surgical exploration to an already open wound. That's the difference. The wound has to already be open. These codes are separate procedure codes. So this is going to be a totally different code from your original code. They can be coded and reported in the following circumstances: if only procedure performed, if totally unrelated to another procedure performed at the same session. So if you're having a procedure done and then something totally separate is performed, but it's still doing that same session of what you were doing, that would be coded as well, but a separate procedure. Biopsy. located in excision subheading. So look at this range, 2200 to 2251. Still a little short range. This is for biopsy. Biopsies for bone and muscle is divided by type of biopsy, which is the bone and muscle, the depth, how deep it is, how deep that wound is, and some by the method that is used for that biopsy. Codes for biopsy of muscle and bones are listed under excision under the general subheading. So all of this information is still under the general subheading. These biopsy codes are further subdivided according to type, muscle or bone, depth, superficial or deep, and in some cases, the method used. So do biopsy codes include the pathology workup that follows the procedure? Remember we talked about that earlier? No, this is coded under pathology. So biopsies can be percutaneous, needle, or excisional coded separately. If lesion is excised and biopsized, only the excision can be billed. So if you're having those two procedures, only the excision can be billed for that service. If biopsy taken on one day and based on the results, an excision was performed, modifier 58 may be appropriate on excision code. So it's going to explain it here. It says, what is the key differences between percutaneous and excisional biopsy? Look at the difference. Percutaneous is open. That's pre, which means before. Percutaneous is open. Excisional is closed. Describe how each type is performed. Describe how coding may reflect several components of the procedure. With a percutaneous biopsy, the surgeon may require use of ultrasonic guidelines with or without a radiologist if the biopsy is sufficiently complicated. So that's the difference. With a percutaneous biopsy, the surgeon may require use of ultrasonic guidance with or without a radiologist if the biopsy is sufficiently complicated. So if it's not that complicated, he won't use the ultrasonic. It'll be with that physician. But if it's seriously and complicated, he might use the ultrasonic without or with the radiologist as well. Introduction or removal. So I'm not going through all of these slides because you're not going to have all of this information on the exam. This is really a short, like I said, it was 3 days, really 3.5 days of information, which is not that much to cover. So I'm gonna go through certain things that you would need to know as far as your NCCT certification and what's going to be on your exam. So introduction or removal, within the general subheading, there are codes for injections, aspirations, insertions, applications, removals, and adjustments. The introduction of removal category includes codes for a wide variety, and these are the varieties that it includes. And then you have your book. You're going to have your books as well when you're taking your exam, so you would know what to look for when it says introduction of removal. What are some things that's used within general subheading for the codes for? And you will have injections, aspirations, insertions, applications, removals, adjustments. In what section of the CPT are these codes found? You all know that's on your exam. What section are these things found? The general introduction or removal. It's found in the musculoskeletal system. I have some things when I put exams and I'm like, I don't understand where the information is coming from because people go back and tell me the respiratory system. And I'm like, we're not even covering anything in the respiratory system. So you have to read, and that's telling me and showing me though, that you're not paying attention. You're not reading your PowerPoint slides. You're not going back and reviewing the Zoom class, the lectures. Go back and review them. Look at the information. And then I'm basically a lot of times giving you what's on the exam. So I don't know if you all didn't remember, like with that pre-test that I gave you all, didn't you all notice that half of that information was on your exam? Half of that, if you all have taken that exam already, the pre-test was basically half of the exam. So I'm giving you the information on the most important information that you all should be reviewing, the most important information that's going to be on your NCCT certification exam, the questions that they're most likely to ask. And then, like I said, it is multiple choice, it is true, false, but you have to know how to find the information. Read your PowerPoint slides, look at your Zoom class lectures, because when we're going through this, I'm giving you a lot of information that's on the exam. So it's showing me, and like I can't stress enough, you all have to understand, this is a career. You all are in class. This is a lifestyle career that is very, very, like I'm saying, I mean, you can make a good living with this background, with billing and coding. Have you all looked into, look on the websites, look on the billboards or ads showing how so many people and companies and jobs are looking for billers and coders? Look, Mister, you say yes. Look.
I have been looking left and right trying to find another job.
But do you see the jobs for billers and coders?
Yes.
And the thing is, though, they want you to be certified. They want you to be certified. And a lot of the jobs now, they're having you take a test before you even get the job. So please do not take this job, this career, your education lightly. This is a very lucrative profession to be in. And right now, as technology is changing, everything is computer-based. Everything is billing and coding. With everything you do, they have to have a biller and a coder. So it's not like, how they say the artificial intelligence can get that because they have to know what to put in. So this is a job that you will have and will be available for a long time. So please take your education seriously and get the knowledge, know what's going on. And I keep saying, if you're having difficulty, let me know and we can do a one-on-one session with strictly finding codes. Because the other information you have to read, billing and coding, if you don't like reading, this is not the profession for you, because you're going to have to read everything. You're going to be reading charts from sun up to sundown when you're at work, reading the medical record to bill the most for that clinic, for that hospital. They're dependent on you for the revenue to roll in. So you have to know and pull out that medical chart, everything that needs to be coded and coded accurately to get the most out of that chart, out of that billing. So just, make sure you're understanding that. Make sure that you're reading everything that you are covering. Like I said, several students have contacted me that have taken the certification exam, that have passed, and stated that everything that we were covering was on the exam. I've had students that have taken the exam and failed by 2 or 3 points and have to retake it. And they stated that they were going back through their packets and going back through their book because they saw a lot of stuff that was in the book that was on the exam that they didn't take serious.
So I started looking through the front medical office for the NCCT.
Mm-hmm.
I started going through and writing down all this stuff that I need to know.
Right. And then remember, again, you can take the medical office part before you graduate. So if you want to get that certification, that medical office administration certification, you can do that before you graduate. And if you need that information package, yes, I'll send those packets again if you need them. So just want you to know how serious this is and how profitable it is as a career. So don't give up. I mean, you might think that this stuff is foreign, you don't understand, but if you're reading your chapters and going through it, reading the PowerPoint slides, you're going to get it. And if you need help, please reach out to me so that I can help you with finding these codes if you're having difficulty with coding. Introduction or removal, it says therapeutic sinus tract injection procedures, not nasal sinus. See, that's it. Not nasal sinus, therapeutic sinus tract injection. abscess or cyst with a passage sinus tract to skin, antibiotic injected with use of a radiographic guidance. The term sinus describes a fistula that leads away from a pus-filled cavity, as well as the air-filled cavities in the bones of the skull. So see, we're talking about, you have to realize everything we're talking about in the musculoskeletal system is muscle and bone. So if it's not muscle and bone, then it's not the musculoskeletal system. And that's why they have you on here when they're showing therapeutic sinus tract infection, not the nasal sinus. Nasal sinus is basically cartilage and tissue, not muscle and bone. Sinus tract injection procedures codes are used for the treatment of an abscess or cyst through injection of an antibiotic or other substance into the infected sinus via the sinus tract. How does the use of radiographic guidance affect coding? It's coded separately. Removal, foreign bodies lodged in muscle or tendon sheath. See how it's telling you? Foreign bodies lodged in the muscle or tendon sheath. Integumentary removal codes for removal from skin. See how they keep trying to let you see the difference? Saying integumentary, removal codes for removal from skin, musculoskeletal system, removal foreign bodies lodged in muscle or tendon sheath. So it keeps stressing the difference because a lot of people get confused and want to code from the integumentary system because, you know, it's underneath subcutaneous, but that is skin. And that can be the outer layer, not going into the muscle. How do the removal procedure codes for musculoskeletal and integumentary differ? Musculoskeletal removal codes are used when foreign bodies are lodged in muscle tissue. Integumentary removal codes are used when foreign bodies are lodged in the skin. The reason why they keep stressing this is because a lot of people get confused with the musculoskeletal system and the integumentary system because you're going into the skin, but you're on that top layer, not going deep into the muscle. So I'm gonna go further down. External fixation. This is the code range, very short, 20690, 20692. Application of a device that holds bone in place. External fixation. Application of a device that holds bone in place. These codes include the removal of the fixator. If it is necessary to adjust or revise an external fixator, see 20693. Code 20694 describes removal under anesthesia and includes imaging. It's a very short section. Very short section. Grafts or implants used to report harvesting through separate incision of bone, cartilage, fascia lata, and tissue. Involve moralized, I'm trying to see, I can't even see without my glasses. Involve moralized or structural bone taken from a donor. So this is when a donor is providing this tissue for you, or from the patient, autograft, allograft, donor, autograft, patient. Martialized small pieces of bone, structural, a segment of bone machined into the space. Report only one bone graft code per operative session. Graft procedures involve harvesting bone, and it shows you there at the top what that is. That's the same thing on grafts. Bone marrow aspiration for bone grafting, 20939. Most commonly used for lumbar spinal fusion, only report in addition to primary procedure when not performed with spinal surgery, reference 20999. Other procedures, monitoring muscle fluid pressure, Pressure increases due to increased accumulation of fluids, causing blood supply to be compromised. Bone grafts are identified by site. They are taken from donor site. Free osteocutaneous flaps, bone grafts, which was in the last chapter as well, taken along with skin and tissue overlying bone. Spine, vertebral column, they're just telling you divided by repair location. So it's a cervical, C1 through C7, C1 atlas, C2 axis. The doctor have all of this in the medical chart. You'll just have to know if it's a C1 atlas, C2, what it is to be able to code. The thoracic is telling you T1 through T12. And this is good to know for your own personal use as far as your spine. Lumbar is L1 through L5. Sacral, SI, and coccyx is a tailbone. So this is good for your own personal information as well, to know how it's divided, how your spine and vertebral column is located, and how it is listed. And they have a picture here that you can enlarge to see how it actually is. Open incision and drainage of deep access of spine divided by location. Cervical, thoracic, and cervicothoracic. Lumbar, sacral, and lumbosacral. And basically, that's basically how the information that you would need to know. You need to know these abbreviations and prefixes and suffixes. Arthrodesis, the code range, fixation of joint. Arthro, remember that equals joint. Desis equals fusion. Fixation with pins, wires, rods, etc. to immobilize the joint. Often performed with other procedures, such as fracture repair. Use modify 51 on arthrodesis code, unless service is reported with add-on code. Coded by approach, site, and number of interspaces or segments. So with this, like I said, you have to know, that's why they say with musculoskeletal system, you have to know the terminology. The doctor is not going to write out all of that information. And, you know, even when he writes stuff, a lot of times you don't understand basically what he's having and what he's saying. So you have to know those abbreviations. You have to know that shorthand stuff that he's writing. So you definitely have to know your prefixes and suffixes, what it means. Arthro, if somebody say arthro, you automatically know that that's a joint. Desis, you already know that's fusion. Fusion means what? Putting together. So those are things that you would have to know with prefixes and suffixes. And it's showing you here, spinal instrumentation, types of spinal instrumentation, and it's showing you here on the pictures. Subsequent subheadings. After first subheading, general divided by anatomic location. Anatomic subheadings divided based by type of procedure. The subsections of the musculoskeletal system included after the general subheading reflect anatomical sites. The anatomical subheadings are subdivided according to the type of procedures. How are codes in the general subheading organized? It tells you by procedure with anatomical location, typically not included in code description. And it tells you here, subheadings. Example subheading, head divided by procedure. And it goes down all the way to the end. Cast and strapping, replacement procedures or initial placement stabilizes without additional restorative treatment. Not code, initial cast is not coded when part of a surgical procedure. Removal is bundled into surgical procedure. Supplies are reported separately. So you need to know that. Cast and strapping in the musculoskeletal system, the supplies that's used for that treatment is reported separately. Removal of that cast is bundled into a surgical procedure. Initial cast, whenever it's the initial cast, not coded when part of a surgical procedure. And this is just endoscopy, arthroscopy. So this is the end of chapter 15, like I said, which was very short. You don't need to know all of that information, just the basics. The exam is very short, but remember, it's due by Sunday. So any questions or concerns in reference to this review or the end? I mean, it's a lot of information, but the good part about it is you don't have to know all of that, just how to find the codes, and to remember that don't get the integumentary system confused with the musculoskeletal system. Integumentary is skin, superficial skin, which is like that top layer. Musculoskeletal is down into the muscle and the bone. So that's the two that you really have to pay attention to, because a lot of people get that confused. And a lot of times when coding is being sent in for reimbursement, they get a lot of kickbacks because they confuse those codes, and they're coding from the integumentary system versus the musculoskeletal system, because they're thinking skin and it's saying skin in the musculoskeletal. But when they say muscle and bone, that's an automatic tip to let you know that it's a difference from the integumentary system. So again, any questions or concerns?
I was wondering if I could stay on with you after we get done with the live.
For right now?
Yes,
Okay,
ma'am.
I do have a few minutes because we have a meeting at 5:15. So yes, we can. Any other questions? Penny, Alice, Jared? We have a small class today. I think you all like that 7 o'clock class better, right?
Yeah.
That 7 o'clock class, and guess what? I'm going to let you all know I will not be available Tuesday coming for the 7 o'clock class. So I'm probably going to, once I see how our meeting's going, I'm probably going to schedule that for Monday, because Monday is going to start a new chapter, and I won't be available on Tuesday for 7 p.m. So I might have to change it until Monday, but I'll let you know something over the weekend when I send the emails out, to just let you all know if we're going to reschedule. But you just make sure you're listening and you watch this again. We might be rescheduling for Monday for 7 p.m.
Well, if it's Monday, you're going to catch me at the house.
Oh, we get to see it. That's your off days, huh, Jared? Yes.
Yes, ma'am.
So, because that starts a new chapter. And if I don't do it on that Tuesday, if we don't have that class on Tuesday, I might do a pre-recorded video and send to you all for Tuesday, 7 p.m. class. So I just have to see on how that's going to work. It might be pre-recorded, and I'll send you out the information along with a video for you all to review. Okay, so if we don't have any other questions, I will see you all later. Have a great and safe weekend. Remember, your chapter 15 exam opens on Friday, November. I'm really trying to rush it. September 22nd, and your exam for 14 and 15, they are due Sunday by 11:55 p.m. So you all have a peaceful and restful and safe weekend. I'll see you all later. And then Misty, if I'm gonna have to stop, what I'm gonna have to do, let's log off and log back on so it's not recorded. Because even if we get off and I stop, it's still gonna be recording.
Yes, ma'am.
So we can get off and log back on.
Okay.
Oh, Miss Barrett, I had 2 questions, but it
Oh,
wasn't
yes.
to the to the lesson. I was trying to see, when does this program end?
This is a 9-month program. When did you start?
I think June 3rd.
So possibly if you started in June, you won't be finished until March of next year.
Okay.
But I can check for you and let you know.
Yes, because I never got that clarification.
Well, you know, that wouldn't come from me. That comes from your from the registrar and from your admissions rep who signed you up.
Yeah, they did. Yeah, that's what I was saying. They never like clarified the exact date. They were saying sometime around January and February, but they never gave me a exact date.
But if you started in June, it wouldn't be January or February if you started in June.
Well, they told me it was a 6-month course.
Who was your representative?
March.
It was, hold on. It's in my email. It was a lady that I had spoke with. I had did like a consultation, and I ended up deciding I wanted to go with this program. And she did all my paperwork. Then she switched me over to someone else in admission, and I did some paperwork with her. And then they gave me to Miss Bridget, who did my financial aid. But it was never clarified what date that the program ends.
Yeah, because it's never been a 6-month program.
Yes, ma'am. That's what I was told.
Thank you. Have a good one.
But did you read your paperwork? Because in the paperwork, it has what it is.
I gotta go back and look at it because I still have everything.
Right. So see, that's why, see what I'm saying, how important it is for reading. You got to read the information because somebody can tell you something, but in documentation and in your information, the packet is in there. 9-month
I
program.
started in March, and I think I'm gonna be done in the end of December.
November, something like that. Yeah.
Yeah. Right.
Well, yeah, 9 months. Yeah, because I know you're
Yes,
going to be finishing in a couple of months.
Yes, I'm gonna go back and read that.
Yeah, but it's never been 6 months.
Yes, ma'am.
Yeah. So just get there, like I said, but I'll, like I said, try to find out who you spoke with.
Yeah.
Yes,
And then,
Heather Richard.
oh, okay, I know, yeah, Miss Heather, okay.
Yes, ma'am. And then Miss Bridget, and there was one other lady. I'm trying to find the email.
But Miss Heather was your admissions rep.
Yes, ma'am.
So that, okay. So I'll talk to Miss Heather as well to see, if she can send you something showing that as well, the clarification.
Yes, ma'am. Because it's saying the link that I did have is expired. That I e-signed on. So.
Okay, yeah, that's only for a few weeks, really.
Yes, ma'am.
Okay. Any other questions?
No, ma'am.
Any other questions, Penny, Jared?
No questions. Not this time.
They have any, okay.
And I'm good too.
All right. So what I'm trying to figure out, Misty, is because this has to be converted. So can you call me on the phone? Because if I click off, it's not going to let me convert to come back on. And that's how I'm able to send you all the link when I embed it in your Zoom lecture class.
Yeah.
That's how I'm able to send it. So once I log off with you all, it's going to start converting.
Oh, okay. Yeah, I can call you.
Call me on my phone. All right. Thank you all. Bye-bye.